Hey, this is Rich Sermonello, Associate Editor at Campus Insiders. I'm here today with a very interesting guest, Dr. Jake VanLandingham, who is really coming through with some groundbreaking type technology which might impact something that we're all aware of, which is head trauma, concussions in the sports world. And thank you for taking some time, Doctor. And maybe you could tell us a little bit about the product Prevasol and how that might transform what we're dealing with now in terms of concussions.
Thank you, Rich. Yeah, Prevasol is a drug that we're developing specifically for mild traumatic brain injury, or what we commonly refer to as concussion. It's a neurosteroid that can get in the brain and reduce swelling and inflammation, as well as oxidative stress that occurs right after that head injury has taken place on the field of play. With Prevasol, we have a nasal application where we can get more of the drug into the brain very quickly on the field of play. And what does a drug like this do for college football and the players that are injured? We really truly believe that the first thing it's going to do is help them, reduce some of the damage that's associated with the injury. After that, we believe we'll get them back to play quicker and safer. We also feel that by taking this drug after a single concussion, it's going to reduce the likelihood that you have future concussions. And I think at the end of the day, what that really does for college football and for sports around the world is it's going to actually help or prevent change of the game. We are seeing so many changing things happen now because of concussion. If we finally take the time to actually treat it, to medically treat it, we can get these things under control early on after the injury and prevent some of these negative long-term outcomes.
Has it been approved, Doctor? I mean, is this something that athletes can possibly utilize today?
This is a new chemical entity that's going to need to go through the FDA. Currently, we're in the toxicology program of the drug development. We're looking forward to, in the spring, entering into human clinical trials at that point, when we can establish the safety and roll through with the efficacy measures of the actual drug in concussed patients.
Could this have, do you believe it'll have long-term help, aid for patients, for athletes in terms of not just their playing career, but warding off dementia, brain type, CTE problems that happen later on in life?
That's an excellent question. Really, the best way to use this drug is to use it right after the injury and to manage it for up to 28 to 30 days following that injury to get the best results. We are currently undertaking a development plan in the lab to understand whether long-term damage can be reversed or at least mitigated by the drug as well. But those studies are just now underway. Most of the studies that have been performed and are looking so promising are those where we use the drug right after the fact and continue its use for about 4 weeks.
You have a very compelling story, a very personal side of head trauma. Can you just kind of touch on how you were personally impacted by something that maybe some of the athletes that we're discussing now have dealt with in their life?
I sure can. Thank you, Rich. Back in 1995, I was assaulted by a vagrant who caused me to have 3 hemorrhages in my brain. I had a very severe brain injury where I had amnesia for 18 months. I lost my sense of smell, dealt with seizures and all of the things that go along with a really bad head injury. I was one of the lucky ones. When I got my memory back and started going back and having a functional life, I went back and kind of dedicated my career just really I can't express enough. There's up to 5 million head injuries a year, and it's such a epidemic. And me knowing what it's like to go through that, and having spent the time to try to understand it better, I get sort of